Seamless handover, thank you. Guys, do you all want to come up and grab a seat and we'll do intros? Yeah, thanks so much everybody for the time. Yeah, Patrick assures me we've got a bit of time to run until lunch. I have got some notes on my phone here, so I may be looking at it. We had such a good prep call for this panel. So the idea of this panel is to get a real perspective from some different customers around what's important to them in terms of, thanks Alan, what's important to them in terms of phone and UC and everything in between. We'll definitely get onto AI a bit as well. But first intros, Chris, do you want to start to give us a little bit of an intro?
Yes, hello. So my name is Chris. I work for Clifford Chance. Clifford Chance is a law firm. It's one of the largest UK-based law firm with 8,000 people, offices across 20 countries. My role is to look after UC and collaboration services internally. So all the tools that Clifford Chance employees use to communicate and collaborate internally and externally.
Awesome, thanks Chris. And do you want to go, Andrew?
Morning, Andrew Wigmore, BA Systems. Like Chris, look after unified comms and collaboration services. 65,000 people using Teams, 40,000 Operator Connect, 22 countries. Some countries.
Some quite tricky countries as well.
Tricky countries, yes.
Awesome. And Alan?
Lastly, I'm Alan Tigg from the Royal Marsden NHS Trust. Many of you may know we're one of the leading cancer hospitals within Europe and the world. I'm the UC manager. I manage roughly about 1,600 Teams users and a lot of fixed desk users as well. We're still using a hybrid platform because we've got highly agile staff.
Awesome, thank you. Yeah, so it was interesting in the prep call, like similar titles but varying remits depending on the organisation. Chris, maybe you could expand on your remit and also the journey you're on at the moment, because you're on an active journey moving towards Teams, aren't you?
Yes, absolutely. So my remit is to look after UC and collaboration. What we consider in Clifford Chance is our email system, our telephony system, our internal contact center, our meeting room experience, and our email security platform. So all the tools that we consider are key for collaborating with our clients. Now, we are on-prem Cisco Telephony at the moment, and we are on a journey to move to Teams telephony. We're actually in the middle of an RFP, trying to select the right partner for that journey and for the support going forward. So I hope I can share some interesting insight in my observations, as much as I can. Obviously, some of it might be still be too early, but I would try to be as collaborative as possible.
That's awesome. And like high level, why Cisco towards Teams in terms of the movement?
So Clifford Chance being a law firm, we are quite heavy in Microsoft ecosystem. Obviously, Copilot, all your document production tools, your Teams meetings as well. So all that kind of led us into Teams telephony. That kind of made sense. Obviously, already having E5 licenses makes sense to use them, but also that single interface for the users that was touched on the previous panel. I think that's important for our users. Now, lawyers are very, very intelligent people. When it comes to technology, they don't have skills to learn anything new. They don't have time for that. So giving them a single interface for the telephony is a key.
Yeah, it's interesting to hear that. And I know Clifford Chance has been quite progressive on Copilot and the AI journey. So it's interesting to see how that has influenced the platform decision as well.
It definitely did. And it was actually quite interesting on the previous panel discussion when they talked about how telephony, the legacy telephony, was always kept outside of your Copilot, your AI. Now it's becoming part of it. So we expect that our lawyers are going to return back to telephony because Copilot will allow them to transcribe the calls, capture the conversations with the clients. During the COVID, most of our users moved to operating on the mobile, receiving calls on the mobile, and I believe that will push them back into traditional telephony for that AI integration.
Awesome, thanks, Chris. Andrew, maybe you could expand on your estate as well, because it's really interesting. And again, you've been on quite an aggressive Teams phone journey.
Yeah, so 2 years ago we had 4 Skype platforms, 65,000 users on those 4 platforms. It's taken until, it was last December, one of your user groups, I come in and said, we've just done our pilot of 3,500 people, moved them to Teams, and that was our pilot.
I like a healthy pilot of 3,500 people. It's good.
We moved the rest January, February off the different platforms. We've still got one Skype platform running. There is people using that for telephony. The majority of people are now in Teams on telephony. 2 main providers operate to connect. There are, as we mentioned, some challenging countries, and we've got people in Afghanistan, Iraq, Ukraine, Kuwait, Saudi. Nobody wants to do Operate to Connect for me, so hands up, no?
And why specifically Operate to Connect? 'Cause obviously there's DR as a service, but you've deliberately gone Operate to Connect.
Simple. When we first started looking at it, probably 3 years ago, I can't remember the company we went to now and said, can you show us this Operate to Connect thing? And on the phone they said, yep, tap, tap, tap. If you go in here, you do this. There you go, you got 10 numbers. And it really was as easy as that. We don't have compliance recording requirements. We don't have any of the complicated bits. And Operate to Connect, it just works.
Yeah, it's really interesting to hear from a customer perspective that it was like a deliberate choice to go OC. And Alan, you're particularly interesting because the NHS is obviously very different roles, very different needs. Maybe you could talk a little bit about your journey, and also there's the big NHS tenant, and then you've got your own tenant. So maybe a little bit about that.
So basically, from experience, I used to work for 2 London councils that merged. So I did a huge Teams migration then of nearly 8,000 people. So I joined the Royal Marsden about 3 years ago on the journey to go to a new UC platform. So they had a legacy platform. We looked at optimising the estate where doctors and nurses, they're very agile across all of our sites. So what we did was we looked at actually give them a single number. Wow, single number, kind of thing. So similarly, you're talking about numbers decreasing. We've done the similar sort of thing that now we've rationalised our numbers, given our staff 1 number each. So wherever they are across the estate, they can reach. So we started that journey about 18 months ago. So we've actually ripped and replaced a whole telephony platform. We've gone for a hybrid Mitel platform because obviously you still need desk phones around. These bits of tin that are on people's desks. Yeah. That people see those. Remember those?
And did you consider Teams physical phones and decide you still wanted a PBX for the Mitel stuff?
We wanted a PBX obviously for the contact center integration part of it. And obviously we've got over nearly 1,600 Teams users on direct routing as well. So basically a lot of our staff, like medical secretaries, clinicians, who work across all the sites, it gives them that gives that flexibility. So whether they're working at home or working within the trust, that then gives them that flexibility to talk to our service users out there in the field and do what they do best, basically.
Yeah, it's interesting, that idea of having UCAS plus PBX. I see that in a lot of healthcare around the world. There's still I
think it comes down to the resilience point of view, because obviously people worry about things going wrong here, things going wrong here. So when they have an on-prem solution, it's a bit of tin that they can tap and say, yes, this works, sort of thing. And obviously we've started to look at collab with a lot of our teams and stuff. We've looked at putting new contact centres in our outpatients teams and looking at putting contact centre in certain other areas so we can actually get that customer focus, so we can actually have a one-stop shop for people to call. Because obviously when people are not well, they don't want to actually be passed around to different people. They want to speak to one clinician who'll be able to give them that service or need that they need.
Awesome, thanks, Alan. Chris, back to you. When you're on this journey of movement, have you considered telephony connectivity, i.e. OCDR, at the same time as your platform migration? And are you looking to one provider to do that? Are you splitting that up? Like, as much as you can talk about it, what's your philosophy there?
Yes, so as part of the RFP, we are looking at a partner who can help us to migrate from the on-prem telephony, but also to deliver ideally Operate to Connect. And I agree over here with Andrew, is that we're looking for simplicity. We're looking for ability to deal with Operate to Connect connection as a commodity, not as another service that has to be looked after. Now, we are looking for a single partner, ideally. We don't want to have multiple different partners managing the same service, but we realize that it might not be possible. I echo what Andrew said, that it's difficult to find a single provider that can accommodate every single location that we have an office in. We are not as remote as Andrew over here, but we do have offices in Middle East. We have offices in China and in India as well. So obviously these are locations that everyone knows are challenging. I'm not going to discover anything new over here, but we do want to go for Operator Connect as a first choice, direct routing as a service as a second choice, and then of course on-prem connectivity if we have to. But it is in the scope for the RFP.
Awesome. And what about compliance recording? Is that part of the conversation? I'm guessing you have some compliance requirements.
No, not at all. Actually, in the legal sector, we don't really have a compliance recording. In fact, some of our clients imply that we should not be recording, because obviously, if you record something, it might be leaked, and some of the discussions are happening before the announcement are being made. So we don't have any compliance recording as such. We do have a recording platform for our internal use, mainly to record calls coming into the switchboard and to our London office, just for training and quality purposes. But it's not compliance driven, it's more of a business driven requirement.
Thanks. Go on, Alan.
Sorry, I was going to say on the recording side of things, obviously, being a hospital, we have the helplines that our customers phone through to if they're feeling unwell, and obviously for compliancy reasons, those are recorded. And obviously, we have our private patient contact centre that obviously the patients phone into, and outpatients as well. All of those calls are recorded. But obviously for PCS, obviously for taking payments and stuff for our patient care, we obviously mute the calls for those. But nowadays, it gives the people that sort of 360 experience. So you can actually, if a patient phones in with a particular thing, they can review it afterwards and stuff like that, which gives them that.
Yeah, I love when we were talking on the prep call and how much of your conversation is about the customer-facing experience and kind of building the infrastructure into that. Andrew, I'm going to come to your stats if you want to pull them out, if you've got them handy, but they're over there. Do you remember them? Alan, just before we go to Andrew, because he's got some amazing numbers on usage and the migration.
I mean, he's way above me. I mean, I feel like an SMB market compared to Andrew here.
Where's Patrick with his 250 users in enterprise? That's not an enterprise.
But Alan, before we go to that, like, how much is AI come into that service conversation, and did that influence your kind of platform choices?
Obviously, we use an AI in a very limited sense, because obviously that sort of Chinese wall and NHS and AI is, people are like that kind of thing at the moment. So obviously we've got AI within our IVRs and stuff like that. So obviously it's learning, it's routing the calls correctly. And also we're looking to dictate into patient records and stuff like that. But obviously, like anything else, it's co-pilot, so you're not driving it. So the actual clinicians are the ones that actually say, yes, that is a true record, and actually punching it down, sort of thing. So there's all of those sort of things. But AI slowly is making its way through. But I think it's sort of starting that trajectory very slow in NHS, because obviously the people part of it has got.
Yeah, it's interesting for me. I mean, it has so much potential in things like the NHS and it's such a big organisation, but equally...
For instance, I mean, my monthly report that I have to do for our CIO and deputy CIO, it's about a third of the time in doing my monthly report by using Copilot just to grab bits of information from various sources, so yeah.
Awesome. So, Andrew, as much as you want to share, like some of the kind of numbers, and I guess speaking to how important phone is in 2025, 2026, you've still got a lot of usage there.
Yeah, so since February this year, Teams on net is 250 million minutes. PSTN is 3.8 million minutes, so a long way down, but there's still a significant amount of PSTN usage. I can't remember the other stats.
And how
64,000 E5 licenses.
How was the migration journey? Because you've consolidated carriers as well, and how much did you do that in-house? How much did you sub it? Like, it's interesting to understand your operational model.
So so Vodafone had all of our phone numbers on their Skype platform. We moved those all to Gamma. Ported them to Gamma first, then they had a redirect into Vodafone, and then the day that we switched them all over to Teams, 40,000 numbers on a Friday morning, and we had one ticket, and that was an actual SIP trunk fault. We did get a company called Insight in. They had a couple of programmers and a project manager who actually built our Vodafone Link platform all those years
that was
ago.
a lucky coincidence then.
Yes, yeah. we got them back again for another project. They come in, they've done this before, they knew what they were doing, and they said, leave it with us, we'll follow all your processes. We got the right people. Friday morning, we're going to start at 6, we'll be finished by lunchtime. No, you won't. Yeah, we will. And it was the most boring day, probably, of the last.
Boring's what you want in a big migration.
Boring is brilliant, yeah.
And your operational team is relatively lean for such a big organisation. Is part of that because it's
4
cloud
people.
platform?
Yeah.
I don't know if you want to say the number, but yeah, 4 people. It's pretty
4
amazing.
people. And most of that is setting up call queues in the queues app, updating our knowledge articles. There's very little for them to do. Yeah.
And Chris, I guess same conversation with you around operational model, because as you move from Cisco to Teams and you've got lots more in your remit, what does your operational model look like internally? What do you partner on?
So we partner with a company called Microland. They provide most of our operational support and it's outsourced in India. And as part of that operations, I have a team over there of probably 14 people. They provide 24/5 support for all the platforms. Now, the expectation is that as we move from on-prem telephony to Teams telephony, the size of the team will decrease. Most of the time taken by this team is on patching, upgrades, hardware replacement, which is going to go away. So we are trying to merge 2 of my teams in India into one single team to then cross-train people to actually allow them to pick up new skills. It's going to take time, we know that. But as part of our RFP, we're also looking for a managed services provider who can do some of that work for us as well, and then estimate how much work can be done by the selected partner and how much of it will have to remain as part of my operations team. So we're still in this discovery phase, evaluating responses from the suppliers to understand what they can do for us.
Yeah, it's really interesting. As people move to cloud telephony, whichever platform, it seems there's a general philosophy that the in-house ops goes down. Either now it's a cloud service, I can sub that out to a partner because there's no, less or no physical infrastructure. But also a lot of the day-to-day stuff is, as Andrew said, is moves, add changes, call queues, config. It's not running the platform.
Not actually croning lines on anymore or anything like that anymore.
Yeah, running actual wires.
Yeah, running actually copper pairs to phone lines and stuff is not anymore really.
We do still have 4,000 lines on PBXs that we're trying to get rid of. Yeah, but I've always had a phone.
Yeah. We haven't had much talk about anything in the previous sessions, but Teams Phone Mobile, I think actually Patrick did mention the mobile as maybe one of the growth areas. Andrew, you've been experimenting with Teams Phone Mobile. Can you give us a perspective?
4 days now, yeah.
Well, yeah, okay. So you know everything, right?
So Vodafone is our mobile provider. They do Teams Phone Mobile. So we do have a lot of mobile people that one day they'll be in the office, the next day they'll be on the shop floor working, checking why they can't bolt in the latest bit of aircraft or whatever. So people do move around a lot. We've also got global business development that are out all over the place. And those are the people that have got 2 numbers to give out all the time, or they've got a mobile number they've got out, but then it's not Teams. So we're looking at Teams for Mobile specifically for that. You've got 1 number. If you're in the office, you answer it on your headset. If you're not, you answer it on your handset.
And 4 days in, so you've got extensive experience now. Like what? It feels like the mobile UCaaS integrations haven't grown as quickly as certainly I expect when they first came out. What are some of your kind of considerations as to why you would or wouldn't go that way?
So ultimately, we will have the Teams app on mobiles. We're not there yet. This Exchange Online stuff is a bit scary for us. It is something that will come to us. I don't know what will happen then, but if you've got the Teams app on your phone, are you?
Yeah, you're in quite an interesting scenario because you're so high security. You're actually gaining capability on TPM to have a single number, aren't you?
Yeah. It's other people's data that we've got. That's the concern. But yeah, it's using the phone to fill that gap, I think.
Yeah, because it's interesting. There's 3 providers now in the UK who are on for it. So UK is one of the markets where there's competition between providers. Other markets there might be 2 or might be 1, but I've certainly heard things about, the comfort of having a single service around the world, but having all those different providers to deal with, or being able to switch between selected providers, for example. Another thing Patrick and Vinbar talked about was right-sizing telephony. So you're all on this journey. Alan, seems like you've had that. Why don't you jump in first?
Obviously, we looked at the estate when we first moved from the legacy platform to the new solution. We actually then spoke to the users, looked at what endpoints they wanted, and then looked and said, well, hang on, why have you got a number in Chelsea? Why have you got a number in Sutton? Why have you got a cordless? And why have you got a mobile? Actually, we can optimize this and give them a single number. So a similar approach we've done is we've moved everyone now to a single number, and now we've freed up something like 4,500 DDIs. So talking about the slides, Finbar and everyone was saying, we're looking to actually rationalize those numbers as well.
So in your case, it wasn't that people aren't having phone numbers anymore; it's that they had multiple numbers.
They're having multiple numbers. I mean, I think we found 2 doctors had 8 numbers each, and I'm like, how can you answer 8 numbers? I mean, it's paradoxical, but
we've all got non-geographic numbers, so certainly our aircraft business development is on one location, manufacturing is another, and people move between locations. So just having that 103 number made a lot of sense.
I think that's where we're lucky, because obviously we've got our Sutton, Cavendish Square, and Kingston, and all of them within London. So an 020 number kind of works for us. But obviously we're expanding with joint ventures in the Far East. So we might be sort of looking at doing direct connect or operator connect for our service people out there, for those sort of users as well.
Andrew, did you get any pushback on going to non-geos, or did people want to hold on to their numbers, or were they not worried? Or
the only pushback we got was receptions, marketing people, those like published numbers. There were a few people, but I liked my number because it was 1, 2, 3, 4, 5, 6.
Yeah, I mean, I go back, I've been doing this since I was doing call manager before I was doing OCS, and it used to be people were very, very wed to their fixed line number. So it's interesting to see there's less of that.
It's still a case in Clifford Chance. We still have some of the lawyers and partners asking for specific Manhattan-based number for the New York office, because they want to be seen as being Manhattan-centric. Some of our users in China asking for specific number or declining a number because it's unlucky number or combination of numbers.
That's interesting.
We do have that.
We did keep certain sequences of numbers back for us to allocate rather than being part of that central pool. So, the 111.
You saved the triple-digit number.
Yeah. We kept all of those. And number allocation is all automated now with the scripts, but we still have an algorithm that looks for all double digits. We'll leave those till the end, but now all the numbers are free to allocate, but the script keeps back the nice looking ones.
I know when we obviously did the migration, we sort of put it in the hands of the users and said, okay, which number do you want to keep? So a lot of them wanted to keep the Chelsea number, obviously, similar to your Manhattan scenario. So yeah, I mean, that worked for us, and obviously we freed up loads of numbers with that. Obviously, prior to joining the Marsden, I was working for 2 London councils that came together, and obviously there was a rationalisation of services, having a single contact centre for 2 councils, all of those sort of things as well. So there's lots of change in that adage as well, and also moving them from 2 legacy Ericsson platforms to Teams. That was a huge change of nearly 9,000 people moving them over. So that could mean good stead moving over 4,000 or 5,000 people, not in the same leagues as these 2 guys.
Well, it's interesting though. I mean, there's definitely there's big numbers, and it's always fun to have big numbers. But these migration journeys, once you get to multi-site, certainly multi-country, I feel like they don't grow in complexity by number of seats. They grow in complexity by use cases or
numbering plans as well. If you have the same digit, I mean, for instance, with the council, I had two number ranges that were shared. So obviously we had to look at, when we moved to Teams, it was brilliant, but... Yeah,
if you're moving from a very clean PBX estate to a cloud service, it's easier. If it's a complex PBX estate, different conversation. Chris, same conversation about thinking about rationalization and numbers. Are you going one-to-one for all your numbers? Are you changing any of that?
Not changing it. So for now, every single employee gets a telephone number, DID number or DDI number. And we plan to keep it like that. Now, some of the costs coming in for Operator Connect obviously reflect that as well. And it's becoming much more expensive to what we're paying now because we don't pay per active DID number anymore.
Yeah, it's interesting when you go from kind of combined trunking to per user, how that focuses the mind on do we really need, even when it's relatively little cost per user, it adds up. And the visibility to see what's being used and what's not.
Yeah, absolutely.
I was going to say, with us, obviously, NHS, we're all looking at money, obviously. And when you look at a cordless phone being £350 and a bit of tin on the desk being 800 quid, and a Teams license at 50 quid a month, 50 quid a year, some of our users obviously are shared, so they have shared phones, cordlesses they walk around with, and obviously desk phones are shared as well. So where we can optimise staff to not have a device, then that's do it. And also we have a single device policy across the estate as well.
And talking of devices, you've got the Mitel in your scenario. Like, is it all headset from a Teams perspective, or have you got physical phones?
No, we've got something like over 1,900 physical bits of plastic on the desk. So mainly sort of corridor phones, obviously for 222 crash type call scenarios, reception points, outpatients and things like that, where they're actually dealing with quite a number of calls. And obviously we've got something like 1,900 cordless phones for our clinicians that work across the state. So they're working in clinics, away from clinics, and also across sites.
DEX, Wi-Fi, what's that?
Wi-Fi.
Wi-Fi.
Yeah, they're all ASCOM basic handsets. And then on top of that, obviously we've got 1,600 people on Microsoft Teams. So, and obviously we have one number per person, similar to Chris's scenario. So we give them the choice of which endpoint is going to be for their purpose, basically. So we do have some wrangles. There are some people that, and also they want gold numbers of very fancy numbers and digits on our direct routing. But yeah, it's working really well.
Awesome. And there's quite a lot of ecosystem providers in this group and out on the floor. It'd be interesting to understand, you mentioned ASCOM there as an example, like what around the solutions, what other ecosystem providers, either hardware or software, have you guys been using, if anything?
So as part of the RFP, we're asking our suppliers or providers to recommend solutions for switchboard, for contact center, for physical handsets, and for analog gateways. And I found that quite a few provided proposed the same solution based on their experience for law firms. There are a couple of solutions that we wouldn't have considered, which are eye-opening as well, saying, okay, well, there are other providers out there that perhaps we haven't considered. So we still haven't made our decision, but we are looking at the partners as well. We found that Teams as a telephony platform might be fit for purpose, but it lacks some of the functionality we need.
Yeah, so it's interesting that, again, that's part of your solution remit is bring us different options.
I think also there is a lot of de facto people out there for certain things, like audio codes for SBCs, and there are other SBC providers out there. Just to make
audio
sure
codes are here, they'll be pleased with that.
Don't wind anybody else up. And obviously things like Mediatrix are very good for the analog SIP converters, but likewise there are other companies out there. But I think it's knowing the people that you know. It's a bit like you buy an Audi because you know it's a good car. You're not going to sort of, oh, do I do that one or not? You know, it's that same sort of scenario. You have that trust in a brand, a bit like what the Cisco guys were saying earlier on. People have a trust in the brand and want to pursue that.
It's interesting when you're going to a hybrid support model as well, because that provider is not putting the kit in and then running away and leaving you to it. They're managing it, so you hope their choice is something they're happy to support.
I mean, obviously we've got analog lift lines, for instance. We've also got panic phones dotted around the estate, which are all on analog to SIP converters. So yeah, I mean, so rather than us having to go around with the old Chrome tool like we used to do, it's all now patched in. It's a lot quicker and a lot slicker, put that way. But also things like contact center, we've got different endpoints on those as well. So we've got Teams enabled for our remote working, so people can work from home. Also, another thing for the collab side of it is our clinicians now are actually doing remote diagnostics as well. So rather than some of our critically ill patients having to come into hospital, they're actually having remote sessions with their clinician. So that saves a lot of the animosity of having to come into a hospital environment.
Yeah, so huge value from the
Huge value, but
video collab side of it.
also it cuts down on the did not arrive type scenarios. So a lot of people we can say, oh, but you don't want to cancel your appointment, we'll give you a remote appointment so our clinician can speak to you. So then that enables that patient to speak to the person and actually get the assistance they obviously need.
Awesome. Same question for you, Andrew. Third party solutions, reporting, recording, anything like that?
Nope.
So all native.
Yeah. We do it to our internal facing IT and HR help desks or Amazon Web Services. But no, nothing else. It's all in Teams at the moment.
That's interesting to see,
And Power BI,
who can
Yeah.
live on what's in the box and who needs
I think
it.
I'm the oddball here then. I was just sat in the middle. But yeah, no, I mean, obviously, we've got a unified platform, which is our main sort of bread and butter. All calls come into that, and then obviously via the audio codes gets flipped over if it's a Teams user or get directed to a piece of tin, basically, if you want to call it that.
Awesome. And a theme we've seen across a lot of the vendor presentations is UCAS and CCAS coming together, that kind of blurry line between those two worlds. I'll start with you, Chris, because it's in your remit. How are you thinking about contact center versus UC? Is it one conversation? Is it different platforms?
It's a one conversation, different platforms. So for now in Clifford Chance, we use contact center for our IT service center internal, our HR, and couple of finance teams who interact externally. Now, in my vision of moving away from Cisco to Teams is to also use contact center for the way that our practice assistants support our lawyers. Because historically, it's always been one-to-one match. So you have a call coming into a lawyer, she doesn't answer, it goes into the PA answers, and the call is answered. Now, with the business transformation, the COVID, lockdown, the one-to-one ratio disappeared. You now are supported by a team of PAs. So that team of PAs might receive a call from any of the fee earner, and you then realize that you lost that one-to-one mapping, and you don't know who is calling, why they might be calling for, how to greet them. And I feel that contact center or customer experience can give a value to PAs that perhaps we haven't considered before.
Yeah, that's really interesting, isn't it? And that's kind of where that UCAS, they wouldn't call themselves contact center agents, but you want that power and capability for them. Have you seen, are they aware, have you seen any pushback over them using a contact center product, but they're not contact center agents?
Yes, you have to be careful how you frame it. So when we had interactions with our PA community, we're asking them if they would benefit from seeing additional information about the caller, the company they're calling from, or perhaps who else they can interact with if the person didn't answer, or if they would like to know what language this person speaks. And they said, yes, we would want that. Would you like to see more reporting about who answered the call, who didn't answer the call? Yes, we would want that. So you kind of fall into the contact center environment, but we wouldn't call you that. You are still
we're going to go with power user. Interesting. Andrew, same question to you. Is contact center somebody else's remit? How does it work with Teams? What's that look like?
Yeah, it's somebody else's remit. We do have a number of call queues within using the Queues app for customer-facing call centres.
And how have you found that? Because for context, for everybody who doesn't know, that's in the box Teams functionality, but with a premium license.
It's everything that we needed to do. Our main IT help desk, that's Amazon, with all of its reporting and stuff like that. But within Teams, no, we're using the Queues app, and it does everything we need it to do.
And do you foresee you and the contact center owner kind of working more closely together, or is it always going to be two different pieces?
Yeah, so
they're not here, so
no. So the problem we've got is you call the help desk and say, "Oh, I've got a problem with my computer." Right. To do a screen share in Teams, you've got to do a phone call. So you've got to drop the AWS call and make a Teams call so that you can then share content. Skype, you could do a non-audio screen share. You can't in Teams. So that's an issue that we...
Oh, so that's interesting. So for internal help cases, it would be preferable if it was...
we can't do that.
We're using Bomgar for that. sort of some of our patients, nurses and stuff,
yes.
using BombGuard to come up to them, but obviously security limitations, obviously with
Yes.
yourself.
We have some people who have access to BombGuard, but when it's like a HR one, I want to show you how to do your HR thing or finance thing, they don't have access to the BombGuard. It's only the IT support.
And Alan, same question for you, contact centre.
Well, I think it's a different hat that I wear, I think. I mean, obviously I manage the contact centres, the infrastructure, not the people themselves. Obviously, we've got 14 contact centres throughout the trust.
Just 14.
Just 14, yeah. So basically,
Do they all run separately, and as much as
they're
you
all-
can share, are they
yeah,
same
they're all-
platform,
they're all
different
in-
instances,
they're all
or
on
different
the
platforms?
Mytel platform. So basically, we've got private care, our outpatients team, and what we're looking at is also things that where we can optimise calls as well, like for our pharmacy team, because when you phone in for pharmacy, there's 7 different types of pharmacy. So what we're trying to do now is obviously look at contact centre in that particular process. So when people phone in, they can actually choose which type of pharmacy they want, whether it be aseptics or SACOT or whatever the different. I'm learning different things, by the way. And it will tell you the different, if it's inpatient or outpatient, or if you're a healthcare professional. We're scripting things now, so patients can phone in, have a single number, and actually make that journey and pathway a lot easier for them.
Awesome. We're getting close to kind of closing out for lunch, but you've got an audience here of service providers, partners, suppliers, ecosystem. Like, I'd be interested for each of you, what would you say to them you want to see more of, or you think there's a gap, or has been a pain? Chris, I guess you're particularly sensitive to this at the moment because you're going through that conversation. Any thoughts on what you would share to this audience?
Yes, I'd like to share an observation. I've noticed that in the last 5 years, we are open a bit more. So there's a lot more collaboration between IT teams in different companies. I think probably thanks to events like this, but also thanks to people like you, Tom, that we're more open to share what we do, how we do it, who we work with, and how they perform. So now we are probably a bit more aware of the suppliers who are underperforming and the ones that are actually taking the extra step to help the clients. So perhaps be mindful of that. So when you bid for a new contract, be sure that you can support your offering based on your reputation with other clients, because we do know a bit more now.
Yeah, thanks, Chris. Yeah, I didn't want to do a big pitch on what we do, but I spend a lot of my time bringing customers together in different forums and roundtables, talking to Microsoft, talking to suppliers. So, yeah, there's so much value in for certainly for different organisations, even different verticals, getting together and sharing notes. So, thanks for that, Chris. Andrew, same question for you. Would you want to pick out your tricky countries?
Tricky countries, Middle East. I don't have India. India apparently is tricky. So yeah, it's places like Qatar and Japan. And the other thing is, so 120 OC providers now. Like
yeah,
that.
if someone wants to rig up my website, I think 106, 107, something like that, maybe a bit more.
It's that many, but if I want telephony in 30 different countries, I don't want to have to go to half a dozen different providers. I want to go, right, I'm going to choose you.
So you're looking for max coverage per provider.
And I want you, provider 1, to then go and talk to provider 2 to provide me all the different
So
places.
it's a sort of a one hand to shake, really,
Yes,
isn't it?
yes.
Is that, did I get that the right way around? It's one hand
Or
to shake.
throat
one
to choke.
I
Either way.
always get the wrong way around, but this time I got it right for a change.
Yes.
It sounds like you've done a big journey in a relatively fast time, certainly a fast time for your organisation, with all respect. It sounds like it's been pretty smooth with the partnerships you've forged and the project you've done, considering you rely on those teams.
Yeah, it had to be.
I mean, 3.5 years of about pilot and just going for it is a big number.
Yeah, we spend a lot of time making sure that when we're doing anything, it's going to work. Which I guess it's the industry that we're in. You have to trust the product that you're using. We have to trust the change that we're making is going to work. Have to trust that when we move 40,000 people from Skype to Teams on a Friday morning, that it's just going to work.
Awesome, Alan. Same kind of question to this audience.
Yeah,
What would you share?
I think, as said, a lot of service providers and stuff. Obviously, everybody is different. There are different idiosyncrasies as we've got on the stage here. I think the good thing is to, when you are doing that sort of pilot analysis, is to actually sit down, talk with them to find out what those idiosyncrasies are. First of all, I think that's what I would like to see, really, because there isn't a sort of a blanket kind of approach that everyone sort of has. It's a sort of an out of the box, oh yeah, we can put UC into your company. Oh, but we can't do that, or something like that. So it's having that engage first, have that chat first with people, make sure that obviously they can do what they say on the tin. A bit like what.
People keep asking me how many personas have we got. 65,000. Everybody's different.
I mean, with us, obviously, similarly to like yourself, obviously being a hospital, the 222 call has to reach somebody. If somebody's critically ill and a 222 call's made, that's got to be made. So when we did the transitions over and things like that, we've got to have resilience in the platform and being able to do what it says on the tin.
Ours is 4444. Is it? and we've got sites where airplanes are taking off and landing, so that that has to work, because if there's a plane down on an airfield, then it's got to get through.
Yeah, and this speaks to, again, somebody mentioned it earlier in one of the sessions, the criticality of phone, where you need phone, you really need phone. Yeah. It's and it's almost gone to an extreme now, and I guess the same thing for you, Chris, not so much like airplanes or hospitals, but I know you're not going to be loved in the organisation if the phone isn't working, right?
Absolutely not. If a client is calling our partner or lawyer, the call has to be answered. It cannot even go to voicemail. It has to be answered by a person. So that's very important that someone is there and it works.
Awesome.
I think probably coming down to the billing minutes as well, isn't it? it's that loss of revenue to the organisation, I think.
I really hope this conversation's been useful and insightful for you. This is the kind of thing we do at EmpoweringCloud. If anybody's not aware, we do forums and podcasts and newsletter and things like that. If this is of interest to you, might be. But didn't want to do a big plug. But mostly I just want to say thank you so much to Alan, Andrew and Chris. It takes a lot to kind of openly share what you're doing in your organisation. So if you could give a hand to this team, and thank you very much.